Welcome. It's Marko Vujicic here. I head up the Health Policy Institute. As usual, I will be hosting this webinar. We have our very capable staff behind the scenes here from the Health Policy Institute, Adriana Menezes and Sylvia Zeno, who are both behind the scenes but currently muted. And let's get started. Okay, so as of last week, which is the data we're going to walk through today, all states had reopened for elective dental care. You recall every week we had a map like this. We're back to full green, at least for now. We'll see where things go. But this is our first wave of data where we have all states open. This is just, again, housekeeping. Did want to highlight we are starting to see a slight drop-off in response rate the last couple weeks. Attributable, we think, largely to just dentists being busier. So one good thing, if you look at the polling research that's been done the last month or two, everybody's gotten higher response rates, which for the wonky researchers is, I guess, one of the upsides of sheltering at home. But in any event, several waves of data you're going to see. The last one is of last week. That's going to be the data we're focusing on this webinar. I do want to highlight that the team has built a dashboard, very simple to use, drop-down menus with state-level data. So I'm going to walk through basically the national data, but if you're interested, and in this case, this is Colorado, you can just go to our webpage there, ada.org/HPI. And you can get the core questions over time for any state you like. You can do it by different dentist age groups, by specialties, by DSO versus non-DSO, etc. It's quite a rich database we built that's user-friendly. So we're not covering a lot of state-level data here, but it's available and you can have at it on our webpage there. Okay, let's get started. So the thing we've been asking each wave is, what's the status of your dental practice? From open and business as usual, all the way to closed and not seeing any patients. We didn't see a huge change the past 2 weeks of data, so basically comparing last week to 2 weeks prior. Not a lot of change. 97% of dental practices in the US are now open. That's roughly where it was 3 weeks ago. But we are seeing more of them reporting things are business as usual. And this is a very rough, self-reported, whatever you mean by business as usual. Obviously, it's not business as usual in terms of pre-COVID, but specifically in terms of kind of like your patient volume and things being back to normal. You know, whatever dentists report on this, it's increasing. So there is some normalcy coming back. This is the key thing that we're tracking. This is patient volume. So our estimate, again, the bottom bar is what we added last week in terms of the data. And we did see a continued increase. Nationally, patient volume reached 70% of pre-COVID levels last week. That is an increase from the previous waves of data, but it's important to note it's a smaller increase. Things seem to be potentially leveling off. And again, this is a rough estimate. As you see here, dentists report categories. We take the midpoints and create weighted averages. But the point here nationally is patient volume could be starting to level off. And again, it's at about 70% of pre-COVID levels in our most recent data. And these are smaller increases over time than earlier in the rebound. Collections, again, similar kind of trajectory, increases, but not as steep. So collections rates are up to about 2/3 roughly almost of pre-COVID levels, and those continue to increase. And our third core question on the economic activity relates to whether you're paying your staff this week. And here again, comparing to the bottom two bars, which is the week of June 15th compared to the last week, yes, there was some increase in the green bar, which is the percent of practices that are paying their staff fully. But it's a slower increase or a smaller increase than in previous weeks. So I don't know, 87% of practices are back to paying all their staff fully. There's another 10% paying staff partially. A very small share that's still closed, about 3%, and not paying staff at all. So the punchline here is, our insight is, practices continue to hire back staff, but the pace is slowing. And we could be nearing what's a new normal in terms of staffing. But frankly, it's, I don't know, roughly upper 80%, 90% of pre-COVID levels. So the rebound in staffing has kind of almost gone back, not fully, but it seems to be kind of a little bit petering out and stabilizing. We also asked specifically non-owner dentists in terms of, are they being paid? And again, yes, I'm being paid fully is the green. Red is I'm not being paid at all. So what's interesting is, when you look here at dental practices back to roughly about 90% of pre-COVID staffing levels, the employee dentists are not seeing as big of a spike back in rehiring. So consistently in each of our waves, employee dentists lag when it comes to being rehired back. And according to these data, about 2/3 of them are back to working like fully, being paid fully. But there's a third that are either not working at all or being paid only partially compared to pre-COVID levels. So our take is that employee dentists kind of have been hit hard by this and have probably suffered the biggest kind of employment shocks. That's what the data are showing compared to the other dental team members. So what's cool is, our data collection last week also coincided with the release of the monthly jobs numbers from the BLS, from the Bureau of Labor Statistics. And we've updated this chart thanks to Brad Munson from the HPI team, who's on top of this. But the green line is the employment level, again, nationally, in the dental care sector, in offices of dentists more specifically. And these numbers are percentage of January employment levels. So we think of this as, okay, what percent of pre-COVID employment levels are we hitting in each particular month? And you see in April that green line just plummeted. So the dental sector lost more than half of its total jobs in April. But it's roared back just as quickly and strongly. So these data suggest that the dental sector is back to 90% of pre-COVID employment levels. That happens to coincide very, very nicely with what our self-reported survey data suggests, which is always comforting. So they're all telling us the same thing. But basically, we're back to 90% of staffing levels, 90% of pre-COVID staffing levels in dental offices. But again, it is slowing slightly. As comparison here, you see the bounce backs in offices of physicians and other healthcare ambulatory services as well. All right, beyond the economic indicators, we've also been tracking PPE availability in dental practices. So right at the bottom is the latest data from last week. And again, we ask, what's the availability of these 4 items of PPE? And green is I have more than 2 weeks supply, and red is I don't have any. So comparing kind of the week of June 15th to 29th, not a lot of change, frankly. So PPE supplies have not changed the past 2 weeks. Frankly, we think it's because shortages may have eased weeks ago. And again, these are averages. So obviously there is a percent of dentists that still can't get these supplies. But again, the changes over time, not much the past 2 weeks. If you're a dentist listening on and you want to find out how the ADA can help get you PPE, just visit ada.org/virus. There are various resources and toolkits there to help dentists. Okay, now getting into the focus of specific questions we asked only last week. And what we wanted to do was we wanted to dig a little bit deeper into what we call capacity, or our maximum capacity in dental offices. I'm going to show you those data in a sec. And we also wanted to see whether offices are adjusting their working hours. The idea being, okay, the data are showing patient volume is roughly back to 70% of pre-COVID levels. Question we wanted to ask as analysts was, all right, well, is that because dental offices can't really take on a lot more patients given the new protocols and procedures? Or is it that they can take on much more, but the patient side is not there, meaning that there's a significant share of the population not booking appointments and not wanting to go? So we kind of got at this a couple weeks back when we looked at how full is your appointment schedule. We're getting at it another way this week, which I'll show you in a second. But one thing we asked was, how have you changed your hours, or how has the number of hours per week your practice is open changed? And the left side is my practice is open fewer hours. That's about 1/6 of practices reported that. The far right is my practice is open more hours. Another 1/6 indicated that. So those kind of cancel each other out. Some opening more, some opening less hours. And the vast majority, over 2/3, have not changed their hours compared to pre-COVID. So our insight here is most dental practices have not changed their hours in response to COVID-19. So I think it's an interesting finding. I don't know if that's because they don't need to extend their hours, they don't have a huge waiting list, or they are booked up fully and do have a waiting list, but for various reasons don't want to or are not set up to expand hours. Again, all interesting questions, but one thing at a time. The data here are not showing any major, in aggregate, change in working hours of practices. Okay, here's the interesting stuff, which I wanted to cover. So we asked last week practices, thinking of pre-COVID, what was the maximum number of patients you could see in a day? We're not asking actual. We're trying to get a sense of what's the full capacity of your dental practice. And in our data set, we have on average about 2 dentists and 8 staff. And in that sample, they report on average, pre-COVID, 32 patients per day was the average across all these practices in terms of the maximum caseload you could take on in a day. All right, so that's kind of the upper bound full capacity of dental practices. It's not to say that they were seeing 32, but they reported the max I could see was 32. We wanted to see how the new protocols or the new environment affected this number. So we asked, okay, well, what currently would be the maximum number of patients you could see in your office? And for that same sample of dentists, they indicated 23.6, so roughly 24 patients. So we also asked them, how many are you actually seeing? And that's the bottom bar. And that's 20.5, so 21. So in summary, pre-COVID, the maximum caseload in our sample of practices was 32 patients per day, the absolute maximum boundary. Currently, that maximum has dropped to about 24 patients. So that's a significant decline in maximum capacity in dental offices. So obviously, you cannot see, or dentists cannot see the same number of patients pre-COVID compared to now. Interestingly, when you compare the bottom 2 bars, what's your current maximum and what's your current actual, they're not that far off. So what this is suggesting is that dentists are close to their maximum capacity under the current protocols and guidelines that they're doing, which are different. And that's important. So due to a variety, this is a key insight, due to a variety of COVID-19 related factors, maximum patient capacity in dental offices has declined significantly. That's comparing the top bar to the middle bar. Patient volume is close to maximum levels. That's comparing the middle bar to the bottom bar. And this is giving pretty strong indications that there's very little slack or excess capacity in the system today. So as you'll see later on, what we glean from this is at least part of the reason why we're at 70% of pre-COVID levels in terms of patient volume are constraints on the supply side. I'm not sure we can see 90 or 95 or 100% of pre-COVID patient volumes, given the new protocols, etc. Now, especially given that there isn't really an expansion of working hours. So these things kind of go together, right? I'm sure that if working hours were to expand, you probably then can take on much more caseload. But in practice, that's not what the data are suggesting. And interestingly, we cut these data in various ways. So again, here are those three numbers for solo dentists, smaller groups, quote unquote, in the middle, and larger groups on the bottom, which is the number of dentists, more than 10 in the practice. Kind of see a similar pattern, kind of a big drop from the top to the middle bar, and then not a big drop from the middle bar to the green bar, or the blue bar to the green bar. And again, you see here, obviously the bottom groups should have more capacity and should be seeing many more patients per day. They are. But what we were interested in doing in this chart was seeing, well, okay, are large groups kind of expanding their capacity? Have they done things differently to be able to see many more patients in terms of their maximum capacity? And it's not suggesting that. It's suggesting some generalizable results here that, look, there's no way the dental system could see the same volume of patients in terms of, well, actually, that's not the right way to say it. The maximum capacity of the dental care system has shrunk significantly because of COVID. Whether the maximum capacity is relevant, that obviously depends on, well, pre-COVID, maybe there was tons of excess capacity, or there was tons of slack in the system, or dentists weren't working nearly as productively on kind of a case or on a patient numbers basis as they could have been. And there were data, we'll get to that, there were data from HPI, if you've been tracking us pre-COVID, that suggests there's about a quarter of dentists reporting, yeah, I'm not busy enough, I can see a lot more patients. So if we weren't near our maximum pre-COVID, then a shrink in the maximum is kind of not as relevant. But again, we'll see how this shakes out. So again, we're trying to get at what's the maximum patient load the system can take now under the new guidelines and new PPE protocols and new spacing of patients and new social distancing, etc. And this is shedding some light on it. And the key insight here is that there does seem to be a capacity side constraint that is important. It's not just a question of, well, there aren't enough patients phoning for appointments. Okay, finally, what we do each time is we do a deep dive into 27 states that opened early. So May 4th, very early on, there was a group of states, 27 of them, that reopened for elective care before the others. And we track those separately as a group. And why do we do that? We do that because they've been open longer than average in terms of other states. And we do that because we think they might be telegraphing where things may settle out. So they're kind of on the leading edge of the rebound. And so let's see if things are stalling in these 27 states. Again, not on this chart here, right? Again, about 97% of offices in these states have opened. So it seems to be like the stable point, at least for now, is 3% of practices have not reopened. That seems to be the case in general, as well as these kind of early opening states. Obviously, a higher share here are reporting kind of business as usual, so that's encouraging. There isn't a leveling off of that green bar yet. But again, we're a little bit unsure exactly what that green bar means when you say business as usual. The patient number data is much more precise. We'll talk about that again. This is really important. So patient volume in these early opening states, so they're basically at least week 9 of reopening, right? So 2+ months of reopening. And I think this is a really important data point on the bottom here, the 72%. You see that, yes, patient volume did increase the past 2 weeks in these 27 states. We're not at a flat line, but that increase is really small. So the key insight here is in the 27 states that have been open for elective care at least 9 weeks, patient volume appears to be leveling off. The week of June 29th, patient volume reached 72% of pre-COVID levels, which was only a slight increase compared to 2 weeks prior. And again, we are interpolating these data. If you were on our webinar a couple rounds ago, we had a panel on with Vujicic and Ty Hamilton and Steve Thorne, who also shared data, and Steve Bushau. And they had higher numbers in terms of where patient volume is. Again, different data sets, different sample of dentists. One was single large DSO. VJ had data on 8,000 Sikasoft subscribing practices. Steve had a smaller sample, but reliable, of dentists. We had largest sample of dentists, and Ty Hamilton from P&R Dental had claims data, right? And all those numbers were giving us different things. We did not have consistency across all our data sets. I think we were on the low side, which is fine. I'm just interested in the changes in the barometer. But anyway, there does seem to be here, and we'll be anxious to see what next week's data show, potentially a slowdown in the rebound or slightly leveling off or plateauing at some point in terms of the patient volume. Staffing levels as well, it's been quite stable here. You see the bottom two bars, no real change, right? So this is important. In these 27 early opening states, hiring was unchanged. So I'm more comfortable saying this is probably telegraphing the new normal in terms of hiring. And it's somewhere around 90 to 95% of pre-COVID levels in terms of employment. We are ahead of the BLS data a little bit. So I think we might be picking up maybe early indications here. That's why the numbers are a bit higher than the BLS data, but not by much in this group of 27 states. BLS data also are not comparable to just these 27 states. They're comparable to all states, and we're very much in line there. But anyway, there maybe is a little bit more upside in the hiring side and employment on dental practices, but it's really plateauing and leveling off. And this is interesting here too. Good news for the employee dentists, if we do have some on. The 27 states do telegraph a potential higher upside than in general. If you remember, we had about 2/3 of dentists who were non-owners had been rehired back nationally. In the 27 early opening states, it's more than 3/4, which is good. So maybe there is more upside on hiring back employee dentists compared to the overall staffing levels, which are already back to pretty high pre-COVID levels. So anyway, our insight here is about 3 out of 4 employee dentists are now being paid fully in the 27 states that have been open for elective care for at least 9 weeks. This is largely unchanged from 2 weeks prior. So employee dentists lag in terms of rehiring, and we could be stabilizing at a new normal in terms of staffing levels. So if you want to push this chart and strictly interpret these data, it suggests that somewhere between 77, let's say rounded up to 80, about 77 to 80% of employee dentists will be hired back fully, paid fully, working full-time. The rest will be hired back maybe part-time, and some won't be hired back. So we'll look for this again next week, but potentially to have 1/5 of this segment of dentistry either underemployed or unemployed, I think is significant. And they continue to be the last ones hired back. So I think employee dentists at this stage, again, early career, let's say more generalizable, are kind of having a rougher go than the rest of the dental team. Okay, and then when there are new data related to the consumer side, we try to incorporate those. And here I'm just taking a combination of new research and new opinion and new news stories. But since our last webinar, and maybe even a bit before, I'm not sure when these were all released, um, research on the bottom right, there was a study out of MIT looking at risk reward for different activities, kind of getting back um, to doing daily normal life things. Dentistry was in the top 3 things that you should be doing, and whatever risk of contracting COVID there is outweighed by the benefits of maintaining or improving your oral health. That's what the scientists found. The Post last week had an article talking about the evidence around different healthcare appointments and which ones you should keep and which ones you shouldn't. And right after cancer screening was a dental visit, so ranked very high. So again, these are just selective examples. Um, so our insight here is as more and more research emerges, it consistently ranks dental visits as relatively safe and worth the risk. Um, Consumer polling, which is a different methodology. This is asking just households what they think. It's not scientists analyzing data. But again, this one I showed at least last time, maybe a time before as well. This poll ranked dental visits as very high on people's lists of things they want to do. And I think, the public places a relatively high priority on dental visits in getting back to normal. That's the insight from this poll and several others. But there is a new one. So we've engaged with a consumer collaboration with our colleagues in our communications division. We engaged a consumer polling firm called Engages that runs what they call a back to normal barometer. And they've been on CNN and the talk shows, etc. They're really industry leaders on what's in the heads of the public. And we were fortunate to partner with them and ask some questions about dentistry. And I just wanted to pull out this chart here. So this is asking people that went to the dentist last year, what's your point of view now on visiting the dentist? And there's a share at the bottom, roughly half, that are ready to go. I just haven't gone, but I'm ready to go. There's a share in green that have already gone during COVID. And then the most interesting ones are the yellow slice and the red slice. So the yellow slice is what this firm deems assurance seekers. And their point of view is, I would be willing to resume this activity, visiting a dentist in this case, as long as a combination of local or national medical authorities, local or national government officials, and or the location I am visiting provided assurances that it's safe to do so. So there is about 12% of the population that is, let's say, influenceable by their healthcare providers, by the authorities, by governments, by CDC, by ADA, etc. And that's why the ADA has launched a partnership to really beef up resources dentists can provide to their patients to give those assurances, right? The red slice is why we partnered with this company. They're the only ones that are categorizing patients in this type of red slice. And those are the ones that feel, I would not be comfortable resuming this activity, visiting a dentist in this case, unless there was an approved COVID vaccine or a proven medical protocol to mitigate and remedy the effects of the virus, which none of those exist right now. So these are folks that basically need a medical breakthrough. They're very risk averse, and they're not really going to be nudged by the ADA or CDC saying something, or their dentist. And that's about 15% of the population. And this is really important insights. So we've showed you data here about the percent of the population that's kind of willing to go to a dentist, about 82%. We're at about 72% currently of pre-COVID volume, right? So I don't know, those, given the ballparking we're doing, those numbers to me are not that far off. And here, roughly 85% of the population, if you take out the red, is either ready to go, already gone, or can be nudged, I would say, fairly easily with some assurances. What's going to be much, much harder, and frankly, what is beyond the control of dentists or governments or anything like that, is the red pie. So this is really, really important, and this is why we partnered with these folks, is that this is telling us that probably 85% of pre-COVID patient volume is our ceiling. Again, in aggregate, I'm not talking about in specific practices or in specific areas. In places and counties in Texas that are flaring up right now, it's probably different than in rural, Oklahoma. Actually, that's not the right case, in rural Montana. But nationally, really, really important insights, and this is why the ADA partnered with this firm. Nobody has this type of research of this granularity and this type of characterization of the viewpoints of the public. So to me, generally, when I look at this, I'm like, this is very positive news, and it aligns well with other data. It's suggesting that the vast majority of the population is either ready to go or needs some assurances from their dentist, from their local authorities, from the CDC, etc., that this is safe and there are new protocols. There's going to be a stubborn, and I don't use that pejoratively, there's going to be just a very difficult segment of the population, for example, to influence, that are basically waiting for a vaccine before they do this and other things. And what's interesting, we asked them to do a little bit of a deep dive into who the red pie folks are. Young, old, male, female, political views, geography, etc. And really the only big thing that came through was they were slightly more liberal leaning compared to conservative in terms of how you self-identify your political affiliation. But there wasn't much beyond that. It's not like they're a certain age group or they're a certain income group or something like that. This is just beliefs and viewpoints that track a little bit with your views in terms of politics, but frankly, not much else in terms of what they track to. So very, very, very important insights. As an economist, it's telegraphing to me, if we hit levels of 85% of pre-COVID volume of patients, probably now that's our ceiling. And that may change with the development of vaccines, which again, there's lots going on there, but nothing on the horizon. And it's not like the yellow bar is ready to go. There's still work to do there in terms of assurances and communications. And there's really been great toolkits. I mean, I mentioned the ADA one, but I've seen great large group practices, DSOs, have really developed good communication toolkits and outreach for their patients. There's lots of this in the market, and these data are suggesting it's important to do that kind of work because that segment of the population, that 12%, will listen to their provider, and will listen to the authorities, and will listen to what the CDC says and ADA and other groups as well. So let me just verbalize the 5 key takeaways from this week, and Adriana then can come in and help us with the Q&A. I'll just read these. So the dental economy continues to rebound. As of the week of June 29th, 97% of dental offices in the US were open, and patient volume had rebounded to 70% of pre-COVID levels. In the 27 states that have been open for elective care for at least 9 weeks now, the rebound is starting to slow down. Patient volume continues to increase, but at much lower rates than in previous weeks. And these states might be telegraphing the new normal. Staffing levels in offices are stabilizing. Employment in the dental sector has recovered to about 90% of pre-COVID levels. However, employee dentists continue to lag when it comes to rehiring. COVID-19 has reduced maximum patient capacity in dental offices, no question about that. But it is unclear how much of an issue this really is. Evidence suggests pre-COVID-19 dentists were, quote, not busy enough and could see more patients. And very few dental offices have extended their hours as a result of COVID. And frankly, those that have been canceled out by those that reduced them. So taken together, this is our big overarching conclusion. The data suggests the dental care rebound is slowing, or maybe might be slowing is a better way to put this. And we might be soon approaching a plateau in terms of patient volume. The evidence suggests that capacity constraints in dental offices might be just as important as demand side factors in limiting patient volume. And that's probably the most important insight we gained this week from our question of the week. So Adriana, let's come back in here, you and I, and let's see. There you are. Hello.
Hi.
Let's see what's been going on in the Q&A box, and
All right.
I'm going to hand it over to you now.
Okay, great. Good afternoon, everyone. Again, lots of great questions. So I did my best to combine some of the themes. So let me start with a few questions that are related to the polling methods and response rates, Marko. So one of the questions was, do you suppose the leveling off of week-by-week production growth could be caused by those opting out of the survey because they are busy now? Another question is, do you have a report showing just those who have reported every week? Yeah, maybe we could start with those two.
So on the latter, it's a good one. We could do that. We haven't gotten around to it. It's a nice suggestion. Let's look at whether that actually changes any of the results. Honestly, we've only seen the last couple of waves a slight drop off in response rate, especially the last one. So we haven't dug into it. We will look into this probably ahead of our next wave. It's a great question. The hypothesis is if busier dentists are dropping out of our poll and the non-busy ones are staying in, that would mess up our results, right? So we'll look at that in more detail. Honestly, we just picked up this response drop in the last couple waves. But certainly none of the other characteristics have changed, like the demographics and things like that. But great question. Let's look into it and see if it matters.
Okay, thank you. Several questions regarding staffing and employment. So Sheila asked, might employment be at 90% because some of the dental assistants and dental hygienists are afraid to come back?
Great question.
Yeah. Gary asks, are you inferring then that the dental industry is likely to lose 10% of the offices or dentists? I'll just read one more in this overall theme. Can you comment about the 90% pre-COVID employment? Does this include practices that might decide not to reopen due to bankruptcy, retirement, etc.?
So on the latter one, yes. So those data would include those that are open, those that are closed, right? So those come from the BLS, and they're monitoring the same sample of dental offices nationally, even if they're currently closed, right? I guess unless they've gone bankrupt and they don't exist anymore as a business, right? That would be different. But again, our data at least 2 rounds ago indicated that only 1% of dentists overall don't intend to reopen. So anyway, the point with this is on the hygienist one, we don't know, right? So the employment could be constrained because dentists don't want to hire back all their staff, or it could be constrained that they want to hire back staff, but staff don't want to come back to work, right? And that's the hygienist question. We don't know to what extent that is. So a few weeks back, actually it was over a month ago, we did ask a question about what are some of the top issues, or I'm trying to think of the exact wording, but the issue of my hygienists are concerned and don't want to come back to work wasn't like the top 3 or 4 in terms of what dentists were saying, right? So my hunch is it's probably more the latter. It's probably more the hesitancy among the staff to come back, rather than a resistance among dentists to hire. And maybe we can recycle that question again this week.
So a question about pent-up demand. How much of the recent spike in the volumes was driven by backlog patients, those that didn't get treatment during the COVID pandemic? And are we getting through this backlog now, and that's why the volumes are leveling off?
It could be. That's a reasonable hypothesis. We don't have specific data looking on what you would consider pent-up demand, how you would define it. Is it a delayed appointment that was rescheduled? Like that would be the most strict definition of that. We don't. We don't have those kinds of data. If you're on a webinar a couple rounds back, there were some other folks that did share some data suggesting, and basically you could look at the share of hygiene visits as a share of total visits. That gives you a barometer of how much is kind of getting back to routine preventive care versus pent-up demand. And the data showed that in several states, actually, that pattern of care had returned to pre-COVID levels. So I know in Texas, right, which was one of the early opening states, or I believe it was Ty Hamilton from P&R Dental, showed basically that the share of total visits that were hygiene had returned back to pre-COVID levels in Texas as of 2 weeks ago. But look, I'm just parroting and sharing other people's data. We don't have anything specific on that. But my guess is it's exactly because we did have pent-up demand, we rescheduled appointments, we were super busy, and now maybe things are starting to stabilize. It's a very reasonable hypothesis. So I don't know, we can think of next round how we might get into that a bit more, let's say scientifically.
Okay, thank you. More questions about procedure mix. So maybe while we're in this theme, I know that you just asked a question that I have here from Farah about the split between dental and hygiene procedures. So I'll read another one from David. Do we have any indication of the type of care that is being performed? Is it primarily emergent? Is it routine care? Is it urgent care? Or have many practices resumed complex rehabilitative care?
So we don't have data on that. We don't have like real-time claims data, procedure level data. Others do. And like Vujicic and Sika Software, they have a nice portal where they look state by state, P&R Dental. Again, and even Steve Thorne, who was the CEO of Pacific Dental, he shared his data last time. It's all trending towards going back to pre-COVID levels in terms of the procedure mix. Where we are relative to pre-COVID levels, I don't know. And I don't know if they've calculated that. So all I can say is the trends were that hygiene was now making up a higher share of total visits, and preventive procedures and diagnostic procedures were slowly catching up and accounting for a higher share. Like in early weeks of reopening, it was very different. It was a lot more restorative care, a lot more surgical care, pent-up demand, but that's leveling out.
Okay, thank you. So a few questions about patient volume and what's next. So an anonymous question. If we assume that practices are seeing 80% of their pre-COVID volumes for the foreseeable future, let's say 24 months, can you speculate as to the impact on the dental practices and professions and also on dental benefits plans?
So that's a good one. So in terms of the impact on the profession, depends kind of who you're talking about, right? So we released 2 weeks ago an updated analysis where we modeled total dental spending this year and next year under different scenarios. And one scenario was we get back to 80% of pre-COVID levels, right? So, I mean, if that's the case, you're potentially taking out 20% of the dental economy. You're taking out 20% of total dental spending, right? Or up to 20% of total dental spending. Other analysts disagree with that. They think we'll get back to normal quickly. And again, that's prediction's a tough business, right? That's why we're kind of very cautious. We're trying to monitor this and see where it levels out if it does level out. On practices, I don't know. I really, again, this is more the practice management folks. What do you do with 80% of typical volume in terms of your practice? My hunch is it's going to make things more competitive and lower margins, especially given the cost sides rising with PPE, right? I mean, PPE is raising variable costs. So I predicted a couple months ago that I think this is going to accelerate consolidation, right? With larger groups kind of winning the day. I'm not sure. The data now show that volumes are kind of leveling out in terms of solo versus large groups. It's not like there's one segment of dentists that are seeing a huge boom and another segment is seeing a trickle. Like that the way we've cut it, like by age, by type of practice, by DSO, non-DSO, kind of the tide is, at least for now in our data, lifting all boats. But what happens when we settle at a new normal, and that new normal is not 100% of pre-COVID patient volume? I think that's where we're going to start to see some potential changes. So again, we've been just trying to predict what that is. Is it 70%? Is it 80? Is it 90? I don't know. If it settles around 80%, my guess is we will see more practice consolidation. We will see some share of practices not be able to be profitable at that stage. The counter argument, and not to be a typical economist here, right? But the counter argument against that is there was a lot of slack in the system pre-COVID. We know that a lot of dentists simply weren't busy, and they probably could have seen more patients. So I don't know. There's going to be a share of dentists that, you know, pre-COVID weren't busy and could have seen more patients, and now maybe they're back to some level in between their maximum capacity and then what they were seeing before. I don't know. I'm just brainstorming here. We'll obviously have more analysis forthcoming on this, but on the benefits side, I haven't thought through what this might do. If anybody wants to chime in and put in some suggestions on what might be the impact on dental benefits. I know we've seen in the last couple of weeks some large dental benefits carriers either give grants to dentists or up the financial resources available to dentists to try to cover increased PPE costs. So that's kind of an adjustment that is making sure the dentists aren't the only ones bearing the financial hit from increased PPE costs. Again, I don't know how big those grants are and how widespread they are. But I don't know. It potentially is going to be a more competitive environment. At the same time, depends on how many people exit. Our last round of polling indicated it's not many at all. About 1% of dentists indicated they were not going to reopen. Vast majority of that was people over 55, probably early retirement, right? But what we showed you here is there's a chunk of younger dentists, employee dentists, that are having a tough time kind of getting back to full employment. So I don't know, if you lose a little bit of the supply and then the demand falls a little bit, maybe things even out. But I can't speculate more than that, but we'll be the first to know.
Okay, thank you, Marko. Shifting gears a little bit, we received quite a few questions regarding tracking cases in dental offices. Some people mentioned specific cases in South Carolina or in Austin. But to summarize, Maria asked, because of the spike in COVID cases in some areas, what are the chances of us going back into another lockdown? And another question here by Robert is the ADA or CDC or OSHA doing any surveillance of dental offices to assess if there is transmission of coronavirus among dental personnel?
So let's take those in reverse. So I know CDC a few weeks ago indicated there were no confirmed cases of transmission. Honestly, our colleagues in science are the ones that are more on top of this. But as far as I know, there isn't a large-scale surveillance system in place for this, but obviously CDC has looked at this. In the ADA, our science group with HPI is collaborating on a study. It's a little different. It's looking at infection rates of dentists. So it's not necessarily tracking transmission, but it will tell us out of 1,000 dentists how many have been diagnosed with COVID, right? And those results we're drafting up in a paper to submit to a journal. So we're looking at that aspect. I don't know what OSHA's doing. It's a good question, but probably for another part of the ADA to answer.
Because of the spike in COVID cases, what are the chances of us going back into another lockdown? $1
million question. I don't know. From my perspective, I think things are very different now than they were before. We know much more about the virus. We know which environments are more risky, which are not. We know about some of the precautions that are effective and some are not. We have new guidelines that the CDC and the ADA and OSHA have really aligned on. We have consistent research now that we didn't have 3 months ago, showing dental is probably one of the things you should not delay. It's worth the risk. So it's a very different environment now. Now, how much of that science gets fed into decisions of governors and health authorities, et cetera, I don't know. But we'll see. My hunch is we'll have a different path than before.
Okay, thank you. There are a few questions regarding PPE use and cost. Do we have any data on how the average cost of PPE is trending? Is PPE being reused? Are doctors charging a PPE fee to patients? Can you comment on that?
Yeah, we don't. It's something we could consider including in our next round. This issue of, are you charging patients? Are you being reimbursed by the insurer? Medicaid, for the Medicaid providers, Medicaid just launched a relief fund aimed partly at subsidizing Medicaid participating dentists for increased costs due to PPE, et cetera. It's not that straightforward about whether you're charging patients or not, but we could get at this maybe, but we don't have any data right now on what percent of dentists are charging their patients or how much, et cetera. I've just heard anecdotes of anything up to $10 to $20 per patient in additional variable costs due to PPE. That's just anecdote, but we don't have anything on that. And in terms of the practices, reusing, when do you change masks, et cetera, that's part of our study we're doing on the infection rates of dentists. So we haven't analyzed that yet, but that will be part of the report that's published.
Okay, thank you. So one question about the impact of this on new dental school graduates. David asks, what impact do you anticipate the new dental school graduates will have on the workforce, especially with a large number of employee dentists not yet returning to work? Have these employee dentists been asked if they are able to meet their financial obligations, or are we looking at a potential number of dentists being forced to declare bankruptcy?
Yeah, we haven't done a deep dive into the employee dentists, the 20%, or well, depends where you look, the 20 to 30% that have either not been hired or been hired back part-time, right? We could potentially do that. We've only asked whether they're receiving unemployment benefits if they're not working, and I think roughly half of them were. So it's a good suggestion from, is it David? To basically do a little deep dive on that, which we could. I'm going to add that to my list. But in terms of new grads, I mean, just like many other industries, despite the pretty healthy bounce back, I mean, it'll be a tougher job market, right? We do have experienced dentists out of work on the employee side or independent contractor or associate side. I don't know how that shakes out in terms of new job prospects for new graduates, right? And that's to be determined. It all depends on where the patient volume and demand side settles. And again, it's looking like it's not going to be 100% of pre-COVID levels. So my guess is the job market will be much tougher for new graduates. But frankly, it'll be tough for physicians and all sorts of other industries as well.
Okay, thank you, Marko. So that ends the questions that I was able to categorize. So a lot of new questions were coming in as we were having this, we started this Q&A session. So I'll just pick a few at random. So I'll just pick the last one that was just submitted. Can we ask the next week what the pre-COVID average patients was, so we can compare that to the current average rather than the max capacity?
Yeah, that's a good one. Yeah.
Okay. Let me see. So more questions about procedure mix. I would suggest going back to the webinars that we've conducted with other panelists.
That's a great suggestion, Adriana. So I believe that was 2 rounds ago, or was it last round? You know, they merge in
It
my
was,
head.
I believe it was a month ago, so early June, the wave
Okay,
of
so that
early
would
June.
have been 2 webinars ago. It would have been the week of early June, June 1st. That one, we had a lot of procedure level data that different panelists presented. So that's a great suggestion. If you go to ada.org/HPI and you click on our COVID tab, all the webinars are there. And I'm pretty sure it's the week of June 1st webinar.
Okay, thank you. A lot of people reacted to your request for more information about dental benefits, including some suggesting maybe you could bring an expert from the field in a future webinar.
Yeah, good.
And let's see.
Yeah,
What else?
that's okay. I'm gonna cut us off here. We're
Yeah,
almost
okay.
up on time. As usual, you've done a phenomenal job. Thank you, Adriana,
Thank
in
you, my pleasure.
collating all those questions. I hope the audience appreciates. I don't know, I see 67 coming in, and you've gone through most of them and synthesized them. So great job. I think we're, you know, close to the end of time, so stay tuned. We're collecting data again next week. Great suggestions from the audience on things to include. We really appreciate that. These are great ideas. We can't do it all in one wave, but let's maybe prioritize. So thanks a lot on behalf of the team, Adriana and Sylvia. Thank you. Enjoy the rest of the day. And again, look for this online. And we will see you again in 2 weeks. Thank you.